Interventional Radiology Procedures Simplified, PICC line, HICKMAN line, PORTACATH, ERCP, PEG, URETERIC stent, colon and OESOPHAGEAL stents, pancreatic and biliary stents, angioplasty, embolization, SIALOGRAPhy, DACROCYSTOGRAPhy. PICC line, a peripherally inserted central catheter, PICC or PICC line, less commonly called a percutaneous indwelling central catheter, is a form of intravenous access that can be used for a prolonged period of time, e.g. for long chemotherapy regimens, extended antibiotic therapy, or total parenteral nutrition, or for administration of substances that should not be done peripherally. Placement. It is a catheter that enters the body through the skin, percutaneously, at a peripheral site, extends to the superior vena cava, a central venous trunk, and stays in place, dwells within the veins, for days, weeks, or even months. HICKMAN line. A HICKMAN line is a central venous catheter most often used for the administration of chemotherapy or other medications, as well as for the withdrawal of blood for analysis. Some types are used mainly for the purpose of apheresis or dialysis. They have also been used in total parenteral nutrition, TPN. 1. HICKMAN lines may remain in place for extended periods and are used when long-term intravenous access is required. PORTACATH. In medicine, a port is a small medical appliance that is installed beneath the skin. A catheter, plastic tube, connects the port to a vein. Under the skin, the port has a septum, a silicone membrane, through which drugs can be injected, and blood samples can be drawn many times, usually with less discomfort for the patient and clinician than a more typical needle stick. ERCP, endoscopic retrograde cholangiopancreatography, ERCP, is a technique that combines the use of endoscopy and fluoroscopy to diagnose and treat certain problems of the biliary or pancreatic ductal systems. It is primarily performed by highly skilled and specialty-trained gastroenterologists. Through the endoscope, the physician can see the inside of the stomach and duodenum and inject a contrast medium into the ducts in the biliary tree and pancreas so they can be seen on radiographs. ERCP is used primarily to diagnose and treat conditions of the bile ducts and main pancreatic duct, including gallstones, inflammatory strictures, scars, leaks from trauma and surgery, and cancer. ERCP can be performed for diagnostic and therapeutic reasons, although the development of safer and relatively non-invasive investigations such as magnetic resonance cholangiopancreatography, MRCP, and endoscopic ultrasound has meant that ERCP is now rarely performed without therapeutic intent. PEG percutaneous endoscopic gastrostomy, HEG, is an endoscopic medical procedure in which a tube, PEG tube, is passed into a patient's stomach through the abdominal wall, most commonly to provide a means of feeding when oral intake is not adequate, for example because of dysphagia or sedation. This provides enteral nutrition, making use of the natural digestion process of the gastrointestinal tract, despite bypassing the mouth. Enteral nutrition is generally preferable to parenteral nutrition, which is only used when the GI tract must be avoided. The PICC procedure is an alternative to open surgical gastrostomy insertion and does not require a general anesthetic. Mild sedation is typically used. PEG tubes may also be extended into the small intestine by passing a jejunal extension tube, PEG-J tube, through the PEG tube and into the jejunum via the pylorus. Ureteric stent. Ureteral stents are used to ensure the patency of a ureter, which may be compromised, for example, by a kidney stone. Plus 7%. This method is sometimes used as a temporary measure to prevent damage to a kidney caused by a kidney stone until a procedure to remove the stone can be performed. Colon and esophageal stents. Colon and esophageal stents are a palliative treatment for advanced colon and esophageal cancer. A colon stent is typically made of flexible metal mesh that can expand and hold open the blocked area, allowing for the passage of stool. Colon stents are used primarily as a palliative treatment for patients with advanced colorectal cancer who are not candidates for surgery. They help relieve symptoms such as abdominal pain, constipation, and bowel obstruction caused by tumors or strictures in the colon. Pancreatic and biliary stents. Pancreatic and biliary stents provide pancreatic and bile drainage from the gallbladder, pancreas, and bile ducts to the duodenum in conditions such as ascending cholangitis due to obstructing gallstones. Pancreatic and biliary stents can also be used to treat biliary pancreatic leaks or to prevent post-ERCP pancreatitis. Angioplasty. Angioplasty, also known as balloon angioplasty and percutaneous transluminal angioplasty, PTA, is a minimally invasive endovascular procedure used to widen narrowed or obstructed arteries or veins, typically to treat arterial atherosclerosis. 1. A deflated balloon attached to a balloon catheter, is passed over a guide wire into the narrowed vessel and then inflated to a fixed size. The balloon forces expansion of the blood vessel and the surrounding muscular wall, allowing an improved blood flow. A stent may be inserted at the time of ballooning to ensure the vessel remains open, and the balloon is then deflated and withdrawn. Angioplasty has come to include all manner of vascular interventions that are typically performed percutaneously. Embolization. Embolization refers to the passage and lodging of an embolus within the bloodstream. It may be of natural origin, pathological, in which sense it is also called embolism, for example, a pulmonary embolism, or it may be artificially induced, therapeutic, as a hemostatic treatment for bleeding or as a treatment for some types of cancer by deliberately blocking blood vessels to starve the tumor cells. Embolization involves the selective occlusion of blood vessels by purposely introducing emboli, in other words, deliberately blocking a blood vessel. Embolization is used to treat a wide variety of conditions affecting different organs of the human body. SIALOGRAPHY. SIALOGRAPhy, also termed radiosialography, is the radiographic examination of the salivary glands. It usually involves the injection of a small amount of contrast medium into the salivary duct of a single gland, followed by routine X-ray projections. This procedure is indicated when there is recurrent swelling and pain on the face, but ultrasound has not revealed any problems. If Sjogren's syndrome, also known as Sicca syndrome, an autoimmune disease that affects the lacrimal and salivary glands, causing reduced tears and saliva production, is suspected, this procedure is useful. Besides, when interventional proecclusion is planned, such as stone removal from salivary ducts or dilatation of the strictures in the salivary gland, this procedure is also indicated. DACROCYSTOGRAPHY. A dacrocystogram is a radiographic examination of the nasal lacrimal ducts, following administration of a contrast medium into the ductus. This is done for lacrimal duct obstruction stricture. Thank you.